Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering bipolar disorder. This is a very heavy disorder, so I don't want to rush through it, guys. So this is going to be multi-part, not just a part one. Before we even get started, if you're new, guys, please go ahead and press that red notification button so you'll be notified every time a new video is released. Press that like button because you're going to like this video. You're going to learn a lot. Guys, don't forget I have audio lessons available for you on my website, nexusnursinginstitute.com, and you can find me on Facebook, TikTok, and Instagram. All right, guys, so let's get started. Bipolar disorder, we're going to start with bipolar 1. Bipolar 1 is worse. It's more severe than bipolar 2. We're going to go over those differences. So let's take a look. Right here, it says bipolar 1 disorder is, look at this, guys, the most severe bipolar disorder. Guys, when you're studying and you see that word severe, pay attention. That's very important, okay? It is the most severe bipolar disorder. It's marked by shifts in mood, energy, ability to function. And what happens is the patient will go through a manic episode where they're high, they're feeling good, they're happy, and they'll go through a depressive episode where they're sad, they don't even want to move, okay? Periods of normal functioning may alternate with periods of illness, the highs, lows, or a combination of both. Like I said, that high is the manic phase and that low is the depressive phase, okay? Individuals with bipolar 1 disorder have experienced at least one manic episode. So they've had at least one high. Mania is a period of intense mood disturbance with persistent elevation. Let's take a look at that word persistent. What did I teach you about that? When you see that word persistent, pay attention. That means nonstop, not getting a break from, okay? Persistent elevation, high, 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 high. Expansiveness, irritability, and extreme goal-oriented activity or energy. Let me explain to you what that means. They will get focused on one thing and not pay attention to anything else. They will pay attention. So for example, they'll wake up and decide, oh, they want to paint the house. And they will start painting that house. It could be storming outside. There could be a hurricane coming. There could be a tornado coming, and they don't care because they are so focused on that one thing. They're so focused, guess what? They don't eat. They don't drink fluids. So their electrolytes are in trouble, right? So with this type of patient, with all patients, actually, you're always going to be concerned about physiological integrity, what's keeping them alive, but especially with this type of patient, especially when they're in a manic episode, because they're so busy and so concerned with whatever it is that they're focused on, they're not going to take time to eat a sandwich for nutrition or to drink fluids. So this is very important for you guys to understand. Symptoms of mania are so severe that this state is a psychiatric emergency. And I just explained to you why. This patient can go through mania to the point that they literally can lose their mind. Okay. Manic episodes usually alternate with depression or mixed state of anxiety and depression. Okay. And I talked to you guys about that high and low. Initially, so at first, individuals experiencing a manic episodes are the happiest, most excited. Look at this, most optimistic people you could meet, right? They feel euphoric and energized. They don't sleep or eat and are in perpetual motion. That's a problem. Because I've taught you that your priority is always going to be physiological integrity, what keeps the patient alive. Nutrition, fluid electrolytes, glucose, sleep, rest, right? You don't want that patient to crash. Hemodynamic status, vital signs, right? So this is a big problem. Look at this. Because they feel so important and powerful, they take horrific chances and engage in hazardous activities, such as irresponsible sexual habits or relations, or gambling, or giving away all of the money in their bank account, okay? As the mania intensifies, as it gets worse, individuals may become psychotic. You wanna know what that word psychotic means? That means out of touch with reality, okay? They may become psychotic and experience hallucinations, seeing or hearing things that are not there. Delusions, which is having that false belief. Dramatically disturbed thoughts. Hallucinations tend to be auditory, so they tend to hear things that are not there. And individuals may begin to hear voices, sometimes the voice of God, or they think it's the voice of God. The initial euphoria of mania gives way. So, they were happy, they were optimistic, but now it starts to give way to agitation and irritability. Utter exhaustion eventually happens, and many people ultimately collapse into depression. There is only so long that you can keep going, that your heart rate is up, that your blood pressure is up before you crash. Okay, and so that's what they're talking about here, guys. Depression and agitated state of mania is a dangerous combination that can lead to extreme behaviors such as violence or attempted suicide. All that anger, all that aggression can be turned outwards, that's the violence towards somebody else, or inward, that's the suicide. Very important for you guys to know this. Bipolar II. Oh, by the way, if you're wondering what book this is that I'm teaching from, by the way, guys, I have like a library of books. I just choose one depending on what you guys put in the comments that you'd like me to teach about, and I'll find a book, on that subject, and I'll teach. But for this one, let me show you what I'm teaching from if you had any questions, if you're wondering. This is what I'm teaching out of, okay? All right. Bipolar II. Excuse me. Individuals with bipolar II disorder have experienced at least one hypo. Hypo means less than, right? Hypomanic episode, and at least one major depressive episode. So they've gone through that low. Hypomania refers to a low level and less dramatic what? Mania. It's still mania. It's just less dramatic. It's just not as severe as the bipolar I, but it's mania nonetheless. Okay. Let's look at that DSM-5 criteria for a patient to be diagnosed with bipolar I disorder. Let me try to make this larger for you to see. All right. For a diagnosis of bipolar I disorder, it's necessary to meet the following criteria for a manic episode. Remember that manic episode, it's on my lip, is the high, all right? I'm not gonna go through all of these. I'm just gonna touch up on the ones that tend to show up more on tests. A distinct period of abnormally, and look at this, guys, persistent, elevated, expansive, or irritable mood, and abnormally and persistently increased goal-oriented activity or energy lasting at least a week and present most of the day. Now look at B, look at what it says here. It says during the period of mood disturbance and increased energy or activity, 3 or more of the following symptoms, 4 if the mood's only irritable, are present to a significant degree and represent a noticeable change from usual behavior. And I put stars next to the ones that tend to show often more on tests. Let's take a look. 1, inflated self-esteem or grandiosity. That grandiosity is thinking that you're much better, much higher than other people. So thinking that you're royalty or that you have friends in the high levels, like you're best friends with the president or with kings and queens, okay? 2, a decreased need for sleep, feels rested after only 3 hours of sleep. Why? Because they're going, and they feel like they don't need sleep. But if they don't sleep, what ends up happening? They end up crashing, right? 3, more talkative than usual or pressure to keep talking. You cannot get a word in edgewise. They're talking, okay? Look at number 7. Excessive involvement in activities that have high potential for painful consequences, such as whenever you're studying, guys, and you see them giving you examples in parentheses, those make beautiful, select all that applies. Hint, hint. What are those examples? Engaging in unrestrained buying sprees, sexual indiscretions, foolish business investments. Okay, and you guys can take a look at the rest on your own. Just press pause. Like mania, hypomania is accompanied by excessive activity and energy for at least 4 days and involves at least 3 of the behaviors that's listed under that criterion B. Unlike mania, here's the difference, guys. Unlike mania, psychosis is never present in hypomania. So in hypomania, which is that bipolar 2, it's not as severe as bipolar 1, right? It's still mania, it's just not as severe. But something else that's important that you have to understand differentiates that bipolar 1 to bipolar 2. In bipolar 2, the patient does not lose touch with reality. They do not experience psychosis. Very important. Hypomania is not usually severe enough to cause serious impairment in occupational or social functioning. So the patient who's going to be hospitalized for this most likely is going to be what? Bipolar 1, okay? Let's jump to neurotransmitters because this is important. The neurotransmitters such as norepinephrine, dopamine, and serotonin were the early focus for researchers who studied mania and depression. A simple explanation is that too few of these chemical messengers will result in depression. So the patient doesn't have enough norepinephrine. They don't have enough dopamine. They don't have enough serotonin, which if you watch my other videos, when it comes to serotonin, what do I call serotonin? The feel-good transmitter, the feel-good neurotransmitter. So the patient doesn't have enough of these 3, they tend to have what? Depression, okay? And an overabundance will bring mania. So too many of these 3, norepinephrine, dopamine, and serotonin, the patient will tend to have mania, and too little of them, they tend to have depression. All right, let's look at assessment. Early diagnosis and proper treatment can help people avoid suicidal attempts. And I put the star next to it, excuse me, because our priority is always what keeps the patient alive the longest, and suicide will kill patients fast, right? So that's very important. That's going to be a priority for you. Early diagnosis and proper treatment can help people avoid suicide attempts, alcohol and substance abuse, because remember, especially when they're in that manic stage, they don't tend to make responsible decisions. Marital work problems, development of medical comorbidities. So general assessment. Individuals with bipolar disorder tend to spend more time in a depressed state than in a manic state. The characteristics of mania include mood, how they're feeling, behavior, their outward exhibition, right? Thought process and speech patterns, thought content, and cognitive function, how they're thinking. So let's take a look at mood, how they're feeling. People with mania are often described as having expansive mood, which is defined as having an elevated and unrestrained emotional expressiveness. They hold nothing back. During this euphoria period, patient may experience intense feelings of well-being, being cheerful, it's a beautiful world, becoming one with God, being overly joyous. The cheerfulness may be in inappropriate circumstances. How are you going to be cheerful at a funeral? Okay. They may laugh, joke, and talk in continuous stream of uninhibited familiarity. Somebody they just met, they're telling their life story. They're someone they just met, they're telling their sexual history. Boundless enthusiasm, treat others with with confidential friendliness, and incorporate everyone in their plans and activities. Everyone's their best friend. They know no strangers. Everyone's a best friend, okay? Energy and self-confidence seems boundless. Remember, they're in that euphoric, manic state. The euphoric mood associated with mania is what? Is unstable. Why? Because this mood may change quickly to irritation and anger when their plans are thwarted. The minute somebody tells them no, or the minute that they're unable to do whatever it is that they had in their mind that they want to do, that happiness, that one with God, that joyful feeling all of a sudden turns to anger and irritation. This is very important. That's why I put a star next to it. You better know it. Behavior. When people experience hypomania, they have voracious appetites for social engagement, spending, and activity, even indiscriminate sex. I talked to you about that already. See, I put a star next to it. Constant activity and the reduced need for sleep prevent proper rest. And last time I checked, rest is part of physiological integrity. That patient needs that for them to stay alive. The nonstop physical activity and the lack of sleep and food can lead to physical exhaustion and worsening of the mania. Individuals may pursue elaborate schemes to get rich, famous, and powerful despite objections and realistic constraints. They can be faced with realistic proof that whatever their plan is not going to work, and they'll still want to do their plan, okay? The excessive spending, use of credit cards, high living continue even in the face of seriously depleted resources. They will literally see their bank account start to dwindle and go down, and they still think that they have all the money in the world. The individual often needs intervention to prevent financial ruin. This is important. Distractibility is a what? Hallmark. What did I tell you about that word hallmark when you see it? When you see that word hallmark, you see cornerstone, you see characteristic. That means it's something important for you to know. You most likely are going to see it on a nursing exam. Okay? Distractibility, that is the hallmark symptom of mania. That means you see that mania needs to be one of those first things that are going through your mind. Okay? They lose focus and go from one activity or place to another. Many projects are started, but few, if any, are completed. That's why when it comes to these patients, they tend to be very hard to work with. But, and I don't mean this in the condescending tone, guys. I'm saying this to you in a way so you can understand, so you can get the answer right when you're testing. You treat them like toddlers. So you know how if a toddler is doing something or they're into something they really shouldn't be, you don't say, hey, stop doing that. What do you say? Oh, Jimmy, look at this. And whatever they were into, they're like, huh, what? And they'll run over to whatever it is you're pointing to. It's very easy to distract them. So, instead of, being mad at them and say, hey, you shouldn't be doing that. No, all you got to do is be like, oh, look at this over there. And whatever it is they were messing with, they will leave it and go to whatever you distracted them from. Okay. Individuals experiencing mania may be manipulative, profane, using bad words, fault finding, and skilled at detecting, then exploiting others' vulnerabilities. They constantly push limits. And that's why patients who have bipolar disorder, when they're going through mania, as a nurse, you have to have very stringent boundaries because they will push their limits and see how far they can push those boundaries. So you have to have very strict boundaries with them. Choices of clothing often reflect a person's grandiose yet tenacious grasp of reality. You'll have an 80-year-old patient that has bipolar disorder. She's going through the manic phase and she wants to walk down the hall in a thong bikini and 6-inch high heels. Okay. Dress may be outlandish, bizarre, colorful, and noticeably inappropriate. Okay, I'm going to stop here, guys, because I have papers to go grade. And my next video will be a part 2. On part 2, I'm going to cover the thought processes and speech patterns when it comes to bipolar disorder. If you appreciate this video, if you'd like to see more content, please sound off on the comment section. Let me know what you'd like to see me cover. By the way, I did a video on bipolar disorder where I actually covered questions. So if you'd like to go over questions for bipolar disorder, just go to my psych mental health playlist and find my video on bipolar disorder. Guys, thank you so much for watching this video, and you'll see me on the next one.